Al Rahba Hospital is situated between Dubai and Abu Dhabi. Was opened in 2003 by His Excellency Sheikh Zayed Al Nahyan. This was a vision, and he was a visionary, that he looking at the community and recognizing that there was no community hospital to serve the population, of which more than 90% are national patients. Al Rahba, since 2008, has been managed by Johns Hopkins Medicine International, and the reason for this management is to bring up knowledge and skills that can improve the care that the community so deserves. We have a growing population in the hospital, but I will focus today on women's services and OB, because 60% of our patients are children and women comprise 35% of all the volume that comes to our Rahba Hospital. Why women's services? And I'll give you some brief statistics to gauge you why we're focusing on women's services. In the last 5 years, we've seen 133% growth in women's services visits. We've also seen in inpatient admissions somewhere around 65%. In the number of deliveries, we've gone from about 1,122 to about 1,824 a year, which is a 62% increase in our delivery rate. And also the surgeries, we're now beginning to perform other types of surgeries besides C-section on non-obstetrical women, such as laparoscopic surgeries. Well, women's health is not only delivery at our Rahba, and so we know that a subpopulation of that group are women with gynecological problems. And so we've also put some strategies in place, from primary prevention strategies to secondary prevention strategies, to improve the overall health of our patients and outcome, and of course behavior modification strategies. One of such prevention strategies is the acquisition and implementation of a mammography unit 2 years ago, and we are proud to say that it is being actively used, and we have seen an increase from last year to this year in the number of women being screened for breast cancer. As you know, it's #1 leading cause of cancer in women. So we have a focus to ensure that we're able to catch the disease before, prevent it before it extends to a bad outcome. Another screening strategy is for cervical cancer. It's also a leading cause of death or cancer in women, and so we take it very seriously, and the screening for this cancer and the acquisition of vaccinations also for this cancer is in place with tremendous growth. We're happy to say that so far we've not found some bad out cases or malignancy, but we continue to tighten up our screening to be sure that everyone who's eligible for screening gets screened. When the baby is born, the baby needs to be strong, the baby needs to have good health, and a simple way to do that is through the Baby Friendly Initiative, recognized and designated by the World Health Organization. We're in the process of trying to acquire that designation. We have the 10 steps in this process. 9 of them, we're proud to say, have been fully implemented. The 10th step, we're working on it, but we're quite comfortable that within the next several months or so, we will be submitting an application to be designated as a baby-friendly hospital. To improve the overall quality of care we provide the patients, to reduce medical errors, to reduce misdiagnosis or completely eliminate any misdiagnosis, we've put some things in place, such as performance improvement projects to see where there are poor outcomes and opportunities to improve. We've also implemented several protocols and pathways consistent with international requirements and standards to ensure that our patients benefit from this, and also that a peer review, an ongoing peer review, is something that will help us identify if there are any areas for misdiagnosis or poor outcomes. As a result of this growing in not just in the quantity but in the value we put on our patients, this outpatient department is being extended, and hopefully within the next 3 to 4 months we will open up a brand new state-of-the-art OBGYN outpatient service department. But the services that will be provided will also be aligned with the 7-star service that our patients so deserve. Thank you so much.